We are shining the spotlight on community nurses tonight as we mark Singapore Nurses Day. They are the ones who go to the heartlands to care for patients, especially the elderly, and numbers have more than doubled across the healthcare sector since 2018. Well, one cluster and a major hospital have more than 40 each, while another hospital now has over 80. And there are now plans to recruit even more as the population grows. But challenges remain.
Leong Sok Yi has been in the healthcare sector for over 20 years. She now cares for seniors at an active aging centre like this one, providing free health checkups, for example. Ms. Leong made the switch from acute care in the hospital setting 6 years ago.
In the acute, it's been a very structured environment. The doctors are there, people are there, so you can rely on somebody. But in the community, actually, I rely on myself and my community partners to get a care plan. To get things moving for the senior, actually.
Ms. Leong is part of the Tan Tock Seng Community Health Team. They serve around 1 million residents in central Singapore, of which over 20% are above 65. It has over 60 community health posts at various active aging centres in the area.
Okay, now you sit down first. Right.
Here, nurses check if seniors are prone to falls. They also refer the elderly for additional health and social care support if needed. However, the hospital says getting more to provide this type of community care remains a challenge.
Being a community nurse is you need to be having certain clinical skill set and be very independent in decision making. And probably that's one of the reasons I think may not take the first step itself. So which is why generally our current nurses who joins us in the community nurses do have a certain number of years of experience because that needs to be built up.
However, Ms. Ng says she has seen increased interest from those looking to make the switch to community care. For NUHS, a healthcare cluster serving residents in the West, and has plans to increase manpower at their health posts.
We are working towards at least a 5-man team per constituency. We are looking ultimately, the 5-man teams comprise of a combinations of both nurses as well as care coordinators. So we do recognize that solely depending on nurses itself, it can be challenging, and there are certain aspects of care can be taken over by non-clinical healthcare.
It aims to have one health post in all 27 constituencies by next year. Currently, it has 40 in 22 constituencies.
Apart from providing care at health posts in the heartlands, community nurses also carry out home visits for those unable to make that trip. And it has proven a game changer for one patient, as we find out.
Kanagasingam Gunaratnam, better known as Mr. K, has been using a motorised wheelchair to get around ever since he had a knee replacement procedure 5 years ago. And he's had to endure at least one scary moment.
Once nobody was in the house, My wife was in daughter's house. She thought I'm okay. 2 days I was on the floor, I went to bed, came back with my towel. I slept, fell down, and then the towel went off, and bare body, 48 hours.
Mr. K was in and out of the hospital for incidents related to his lack of mobility. To provide continued care, nurses made visits to his home. Since then, the 85-year-old's situation has improved significantly. He was cared for by the same nurse for about 6 weeks over a 2-stint period. During these visits, she helped Mr. K keep track of the types of medicine he needs to take and carried out general health checks.
She is really a jewel of a woman. She go down, they call it extra mile to make sure I'm okay. You heard about Florence Nightingale? There's something like that.
Mr. K no longer needs home visits. And he's also mobile enough to make trips on his own to this community health post.
So I think it's important to build a patient and nurse relationship in the community care setting. Because with the good rapport that we have, we can slowly give them the appropriate recommendations to help to improve their health.
He's all smiles now, thanks to the support around him.
Well, seems like there is plenty for nurses to do, but just not enough hands to help. The government has been bringing in more foreign nurses to boost the ranks, but they'll still need to be trained and meet certain standards. Well, two nurses from Tan Tock Seng Hospital are here with us to tell us more. Senior Nurse Manager K. Suvaseni and Nurse Clinician Julie Solomon, who came to Singapore in 2009. And I'm just going to kick things off with you first, Suva. We have to meet certain standards. So what kinds of qualifications or skills do we look out for in foreign nurses? And also, once they are here, how do we even begin to train them?
Yeah, so basically they need a practicing certificate, nursing certificate. They should be either a bachelor or diploma holder for nursing, and they need to meet the SNB requirement. So registration to SNB is very important. So to come in as a registered nurse, they need to be a bachelor in nursing. They need a bachelor in nursing. They must at least have a minimum 3 years or more experience working in their acute hospital back in their home country, and they have to sit and pass for the RN licensure exam. So in order to continue to work in Singapore, a provisional license will be given them under 6-month probation. So during this 6 months, they have to go through the clinical competency assessment and pass the clinical competency assessment to practice as a staff nurse in Singapore.
Well, Julie, you have had 9 years of experience. You had 9 years of experience as a registered nurse in India before you came to Singapore. Why did you choose to develop your career here, and what have your experiences been like?
Hi. Like many international nurses, I came to Singapore for a better future for myself and my family. I chose Singapore because it is close to home and the country that opens to international talents like me. Moreover, it is a safe country to work and with attractive salary. The experience has been very enriching and rewarding. I have grown personally and as a person. I started my career as an enrolled nurse, and now I'm a nurse clinician in one of the medical ward in Tan Tock Seng Hospital. I feel that the Singapore healthcare facilities are well equipped and the working environments are more supportive.
Now, Suva, the wonderful environment that has been created, and I also want to mention that you have done stints overseas. And when it comes to your experience abroad, how has that helped you, in designing the training curriculum and also integrating foreign staff like Julie?
Yeah, actually, my overseas attachment was about 3 decades ago, because now nursing has already evolved a lot. But however, I get reminded of my personal experience, how I was feeling, when I was in overseas, lonely abroad. And this helps me to understand how our foreign nurses are feeling for it now, and motivates me to do my best to make them, feel as a part of TTSH family.
Well, Julie, as Suva just mentioned, she has seen the environment, the whole industry evolve in her time, in her decades devoted to this profession. Do you find expectations for foreign nurses such as yourself, when you first came, the expectations then, are they different from what you see now?
Yes. Over the years, experience for the expectation for the foreign nurses may have evolved slightly, considering the changing healthcare landscape and the continuous drive for improvement. However, the core qualities and qualifications sought in foreign nurses, such as clinical competence, empathy, and communication skills, remain crucial.
Oh, thanks. Julie and Suva, stay with us. We will be continuing the conversation with both of you in just a moment. But besides getting more manpower, machines are also working around the clock to save lives. alongside their human counterparts. One healthcare group has a growing team working on tech projects to boost care efficiency, while another group is refreshing resources for patients to better manage their health. Sherlyn Xia checks in with the nurses leading these efforts.
Round the clock, ambulances stream in with lives on the line.
The emergency department is an always busy, fast-paced environment. And with the type of urgent cases it sees, it also means that there are high patient volumes. Here at the National University Hospital, I'm here to meet one nurse who has gone above and beyond in helping the sector tackle its challenges.
And as if on cue, Sophia Saw springs into action. The 30-year-old has spent 7 years here.
So in ED, we see a range of patients. It can be a laceration of the hand, to even a heart attack or a trauma case like a road traffic accident. When we see those kind of patients who come in, you know that they may be on the brink of death already, and you manage to save them. That really gives you a lot of satisfaction.
Sophia also co-leads a work group for the National University Health System, working on solutions to improve efficiency.
We're here now with a new robot friend that could in the future be making its rounds around the hospital. Now, Sophia, could you tell us what it does?
Okay, so this is Missy. It's a nursing robot that is designed to help our nurses in the future. So we have identified 3 main tasks for it to do for now. This is the robot arm that can be used to help the nurses to do vital signs monitoring. And then we have cabinets at the back that can help to store items and fetch items when needed. And it can also be a sitter that watches over patients who are at high risk for falls.
It's hoped that such tech could relieve manpower woes, freeing up nurses to tend to more urgent patient needs. Next, I head to the Ang Mo Kio Polyclinic to find out how nurses in primary care are also making a difference. This is 64-year-old Lian Hua, with over 40 years of nursing under her belt. She trains nurses across the National Healthcare Group to be specialised care managers, who provide one-on-one counselling for those with long-term medical issues.
I've just been getting a simulated education session on what patients with chronic diseases like diabetes may go through, and the aim of it is to equip them and caregivers with better skills and knowledge on how to handle such conditions in their daily life.
Lian Hua has dedicated the past 14 years to such chronic disease management.
It has been challenging as well as rewarding. Challenging because I cannot change people's behavior all the time. Some do have barriers that they were not able to change. However, I also enjoy nursing because I believe patients can be improved, and then the quality of life would be definitely improved.
She also supervises junior nurses in their daily routine and hopes to groom more to take up higher roles.
Right, let's pick up where we left off. Ladies, we just heard about the various technology out there being harnessed to help ease the burden on nurses like yourselves. Suva, so which is the most important technology that has actually helped you with your work?
So, I could say due to aging population and tight workforce, more healthcare staff will be needed to run the hospital, clinics and nursing homes. So smart ward, which previews the future state of inpatient, accelerate the adoption of smart solutions by test fast, learn fast, scale fast in real patient environment. So for instance, we have got these gadgets and automated equipments that was brought into Tan Tock Seng Hospital, which Julie, you can explain more about this presage thing that has been implemented in Julie's ward. Yeah,
right,
Julie, can you help me to say
let's
something?
pick up on that. But Julie, before you discuss this presage technology, a quick question on how this kind of technology, in principle, it helps you. So it might mean less work for you, more basic work. So you might concentrate on doing more sophisticated things, which machines, at this point at least, cannot do. Do you find technology such as presage helping to keep staff Or do they sometimes demoralize staff because they make staff feel, you know what, we're not really needed?
Okay, as you shared, Sister Shiva also mentioned that challenges that we will be facing, aging population, complexity of care, lean workforce. The innovation is about pushing boundaries and challenging the status quo and introducing meaningful changes to improve our lives, industries and the world where we live in. And innovations are enablers that substitute and take over the non-value added tasks so that the nurses can spend more time on value added tasks such as direct patient care. Yeah. I would like to share some innovations implemented in Tandoxing, one of the smart world regarding Presage, just now Sister Shiva mentioned. So Presage is the one which is help to anticipate falls with sensors and AI technologies. And it is the bed exit prediction and prevention system, which empowered with the artificial intelligence to detect and predict the bed exits, which allows a 15 seconds of pre-exit lead time for the nurses to intervene before the patient assumes to standing position from the bed. During the evaluation, the Prestige achieved a sensitivity score of 100% of bed exit prediction. There was a 34% reduction in fall rate and 67% of saving manpower hours. We too have, just now in news also say that regarding the robot, we too have in the wards, Peter, delivery robots. Usually, we use we need two staffs required to push the heavy food trolley from the cubicle to cubicle to serve diet for our patients. With this delivery robot, deployed to automate process to reduce the manual labor. It can deliver heavy items across wards, food trays to patients, cubicles, and bring joy to patients and also the family members when we have Peter to sing the birthday songs on their birthday. The daily time taken to serve patients' meals reduced from 60 minutes to 35 minutes per ward. This means that more nursing time can be focused on providing direct patient care instead of performing logistical and laborious tasks, improving overall patient and staff experiences. We also want to say we too have different nursing tracks which nurses can specialize into. Example, nurse innovators, nurse educators, researchers, and advanced practice nurses, etc.
I'll thank you both of you for spending your time with us this evening. It was Senior Nurse Manager K. Subaseni and Nurse Clinician Julie Solomon from Tan Tock Seng Hospital.